it's Dr. Shelly with Shelly's Nursing Review on my YouTube channel, HETV. And I want to remind you how this works. So I'm going to be talking about Parkinson's disease today, but I don't want you to forget that every single one of you watching out there in the world somewhere is entitled to a complimentary packet called the Oh My God packet for free. I don't want nothing in return. I just want you to know that I want you to be a nurse. And so you are entitled to get that. And so watch till the end to find out how to go about getting that complimentary packet, which is a wonderful study guide for how to pass the test, right? Now, while I'm teaching you on Parkinson's, there's a couple things I got to get out the way first. First, let me just say, while I'm teaching you on Parkinson's, remember that for my program, I use Grey's Anatomy on Netflix to show you the application of the disease process. So for this disease process, Parkinson's, I want you to know that season 1, episode 6 of Grey's Anatomy is where you will see this gentleman with Parkinson's going through a lot of what we're going to discuss today. Also, my job is not just to share the disease process, but to get you to pass the NCLEX exam or the unit test in your school, your nursing school. This disease will be located, for future reference, under my neuro playlist. If you've been to HETV before, you know what I'm talking about. I'm about to bore you for a minute. But if this is your first time, you should know that I have an entire content for basically nursing school and NCLEX, all organized really nicely under playlist. So this will be under the neuro playlist, as well as I will probably tuck it into the geriatrics playlist as well. Lastly, excuse me. Did you hit subscribe yet? Because I'm talking good shit here. Lastly, back to professional. Lastly, I want you to know that I'm trying to get you to understand clinical judgment. This new next generation NCLEX exam has what we call clinical judgment that it's testing for. In fact, I had a young lady who was not in my class. She registered for my class the other day, and she had failed this next generation NCLEX exam. And when she failed it and she got her report back, it gave her scores in clinical judgment. Now, I already have a video on clinical judgment. Remember, there's 6 parts to it. What I'm trying to tell you today as I navigate through this lecture is that the 2 parts we're covering today in the initial stages of discussing Parkinson's will be recognizing the cues and analyzing the cues. Now, these 2 are not the same. They sound a lot alike, analyze, recognize, no, but they're not alike. Analyze, I'll give you an example, okay? Let's say a 15-year-old patient came in from a motor vehicle accident. Y'all with your girl? When you analyze the cues, when you recognize the cues, like when you take that first step of the clinical judgment model and you recognize the cue, 15 should have felt like a cue because the age of the young lady in the motor vehicle accident, 15 holds a lot of meaning in an NCLEX exam, right? So if you think about it like this, she's 15 means 3 things to me. It should mean 3 things to you too. I'm not alone in this, right? The 15-year-old should mean something about consent forms. Her parents need to sign them with the doctor. If she's not with her parents, we might have to use something called implied consent. Okay, number 2, 15 should also mean that you incorporate growth and development concepts in your answer. Number 3, when you recognize this 15 as a number that means something, when you analyze it, you should analyze the fact that not only do you need consent forms signed by the parents, not only do you need to incorporate growth and development principles because she's only 15, you also need to make sure that she is not pregnant in whatever you plan on doing. In other words, females of childbearing age, that's a further analysis. So you recognize the age as a cue, you analyze the age to mean consent form, could be pregnant because she's a female, And of course, she needs growth and development principles in the answers that you give. That's what I mean by today's lesson of Parkinson's. We're going to recognize cues and we're going to analyze them for what they're worth, okay? So let's get started. You did subscribe, didn't you? Here we go. Parkinson's disease is the #2 neurodegenerative disease in America. What I'm saying about this neurodegenerative disease is that the very first one, the most common one in America, is Alzheimer's. Well, guess what? This is pretty common as well. It's #2 in the lineup. Then I want you to know that there's no single solitary test to diagnose Parkinson's. Oh, no, 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 no. You're going to do several tests to rule out other problems, like a lumbar puncture, an MRI, a CAT scan. This patient will receive multitudes of tests and blood work because sometimes Parkinson's is misdiagnosed as the genetic rare disease of Huntington's. Okay, so stay with your girl. Sometimes Parkinson's can be misdiagnosed as multiple sclerosis, myasthenia gravis, amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's. So when you're looking at your clinical judgment, you're trying to focus on what signs and symptoms make this strictly Parkinson's most likely, because you don't really know until you do all this workup and that sort of thing. The next concepts that I want you to think about is that men are more likely to have Parkinson's than women. It's not that women can't get it, don't get it twisted. Women and men get Parkinson's, but it's usually most likely 50% higher rate of Parkinson's in men. We see this very much more commonly in white males than any other ethnicity. So that's important. And then we see this in patients over 60 more than any other age group. So it's not that you can't get Parkinson's before 50. Look at Michael J. Fox. It's just that the majority of patients are usually over 60 at the time of their diagnosis. Now, when I go over some important shit, and I know I can check it off, I'm gonna erase it. So don't be mad at me if I just like get rid of this. But again, you know what's up. Now let me point out something else. When I said neurodegenerative, it's very important that you know how this, just knowing that it's a neuro disorder, impacts your approach to the patient. Here we go. Chronic, it's a chronic issue. Progressive, there is no cure, so it's going to get worse. Neurodegenerative, neurons, nervous systems going to go downhill, degenerate. These patients with chronic progressive neurodegenerative diseases, you must remember to always ask about advance directives. You must always know that the #1 cause of death for these patients is respiratory failure. So you are very much cueing in to their respiratory system when you admit this patient. You must understand that based on the fact that it's a progressive neurodegenerative disorder, falls precautions and dysphagia precautions might need to be implemented upon admission. And by the way, this is true for 99.99% of all neurodegenerative diseases. So whether it's multiple sclerosis, myasthenia gravis, amyotrophic lateral sclerosis, which is your Lou Gehrig's, or Parkinson's, no matter which one of those it is, and there's many more, trust me, you have to focus on these specific items. Now, I'm going to go ahead and erase this, and then we're going to talk about cardinal symptoms. There are four cardinal symptoms. And I always want you to think of cardinal as meaning like hallmark symptoms to make this stand out better than other things, because it is true that some of these diseases look a lot alike. such as your multiple sclerosis and all the rest. And so what makes this patient have Parkinson's? Well, let's look at some of the cardinal symptoms. There's 4 of them. There is tremors, which is really early. There is something called bradykinesia, and one of the things I teach you when you're in my class is break shit up and to understand it better. So brady, of course, means slow or low, right? And then kinesia, kinetics, means to move, slow movement. Boom, you got it. Muscle rigidity, which also happens kind of early. And then something that happens super duper late is this akinesia or akinesia. But what I want to point out about that word, because I'm a real stickler about vocabulary. My PhD is based on the fact that you don't always fail the test because you don't know it. You may fail because you don't know what the words in the test mean. And so you got to really look at words and break them all up if things sound kind of crazy. And if you're like me, you're like, akinesia, what? Okay, so A before a word means without. Kinesia, kinetics meant movement. So akinesia means what? Without or no movement. You got this, okay? So that's what I'm talking about with how to break up the words. Now, so we're going to go a little bit further into great detail because, again, we're trying to recognize cues and analyze cues. Here's some more recognition of this is what this is, and it can't be anything else. These tremors in the early presentation of the disease are going to be unilateral at first, and it's going to be in the arm. Now, I got to tell you, when you're thinking about Lou Gehrig's, that can also be true for Lou Gehrig's because they get these like twitches in their shoulder and their arms. But I'm just saying, we got to start off with the very earliest sign. This is the earliest sign. You may have learned in school pill rolling, right? Yeah, pill rolling. That's what that is. It means your fingers are doing like this, but again, it's unilateral at first, and then you go to both of them. And again, season 1, episode 6 will show you what that looks like. You have this tremor activity in the arms and the hands, even at rest. That's the first sign. You're not doing anything and you're tremoring, right? You're just shaking, okay? Now, stress will make it worse. This patient with this pill rolling and tremors, you ask them to sign their name or maybe sign the consent form. Not you would never do that. The doctor or the nurse practitioner does that, not the nurse. But you notice while the doctor or the nurse practitioner is getting them to sign the consent form, because that's on the test, you do not get that signed. The provider does on the test. While you're noticing they're signing this, you will notice something fancy dancy 4-letter word up here. Micrographia, teeny tiny writing. Teeny tiny signature, squiggly little signature. That's another tip, okay? Again, this is early. This tremor business that they go through can even affect their lips, their mouth, their tongue. You may even see that twitching and the tremors and things in the face, okay? Now, bradykinesia is not an early sign. No, this is more moderate, stage 3, while the tremors was mild, early, first stage, boom, okay? Now, stage 1 is definitely tremors. It's the earliest thing you're gonna see. Once the tremors moves to bilaterally, both sides of the body, now we can call that stage 2. When we're looking towards a moderate Parkinson's, moderate or stage 3 Parkinson's, this is where the bradykinesia comes in. And it's not just slow moving, it's also slow thinking. We see a lack of an arm swing. So the patient's arms do not swing when they walk. No, they're mostly forward. The patient is stooped over. And the reason why they're stooped over is compensation, really. So they don't fall because they're dragging their feet, they're shuffling their gait. They could easily fall. And so this patient has a lack of an arm swing. They may even, as the disease advances into a more later stage, they may have difficulty swallowing. So, you know, that's going to play a role when we start generating solutions and thinking of what the plan of care should be. And so when we're looking at the patient's face, I don't know any other disease, not MS, not myasthenia gravis, not Lou Gehrig's, not Guillain-Barré, not Huntington's, in which the patient has a blank expression and they do not blink their eyes very much. So there's very little blinking. The expression is blank. It almost seems like their eyes are stuck. And there is something called bradyphrenia or slow thinking. Brady, slow, phrenia is actually, you know, not something I would expect you to remember, but bradyphrenia is slow thinking. It takes a minute to process things. It takes a minute to answer your questions as a nurse interviewing them. And so that's it right there. Now, some more early signs. Some more early signs include muscle rigidity, very early. This cogwheel jerking type of motion. And this cogwheel is basically like this wooden wheel. And I know I got to go way back when Caesar was a little boy and Moby Dick was a guppy and Jesus was a baby. But I want you to try to think of your big mama and them, you know, like your great-great-grandmama and them, watching things from way back when called country westerns. And some of the shows they was watching was called Bonanza, High Chaparral, Wild West. Me and my brother used to say Wild West. I know it's called Wild West, but me and my brother called it Wild West. Okay, so Bonanza, High Chaparral, the Wild West. If you watch those shows, I want you to reflect back to Big Mama sitting in her rocking chair, boring you to tears with that show on the television, you know, the floor model television. You know, back then they had floor model televisions with a remote control. Don't act like you don't know, you know. And so when you was watching that show back then, every now and then on those shows, there would be these people in the buggy, right? There'd be in the horses would be carrying the buggy, and you'd have, oh, Little House on the Prairie, that might be more your speed. And they'd have their bonnets on and their cute little flowery dresses, and they'd be sitting in a little buggy, and the buggy just be going. And you got to remember that the wheels are wooden. You got to remember that the street was dirt. And so every time they would roll over the dirt, they would be jerking and shit. You remember, y'all know, y'all act like y'all brand new, you know, shit. Okay, so this cog wheel motion, that's on your test. Yeah. So what I'm trying to tell you is, if I'm up here acting like a natural born fool for the sake of you to pass your test, you can pay attention. Cogwheel, jerky, movement. Okay? You got this? Now, as God is my witness, you're going to see that shit in Grey's Anatomy. You can thank me later, boo, for all that demonstration. Okay, keep it moving. Shit. Patient is fatigued. They're tired. They don't have time for you to come in here and be doing a bunch of stuff. You done gave them their breakfast. They brush their teeth. They got their face together. Now leave me the hell alone because I'm tired. I'm tired. I can't do too much. Okay? Stiffness. It's so bad that these patients have cramping in their toes and their hands. Like it's almost like contractures. It hurts, you know, it don't feel good. A very late sign, and this is sad, is that this patient with akinesia has no movement at all in terms of freezing. So they'll be like trying to walk, and their feet will literally get stuck, and they cannot get out of that trance, I guess you could call it. So those are called freeze-ups. These are the cardinal symptoms of this disease. Now, I want to point out something as to why in the hell did that happen. Well, we think that there is a minor type of genetic association. In other words, we could never ever call this a genetic disease like Huntington's, but it seems to have some kind of familial tendency, which means it would not be shocking for more than one person in the family to have it. Y'all feel me on that? Okay, another possible contributing cause is environment, right? And for that, we're talking about pesticides, herbicides, metals and things in the occupational workforce. When I say pesticides and herbicides, don't let it worry you, Jerry Curl. You ain't got no money right now. But when you get to be a nurse, you got to think like me. I'm really not about the pesticides, okay? And I'm so not about preservatives in my food and steroids and shit. So when you become a nurse, go on and get that organic shit, okay? Take your behind to Trader Joe's and shop there, or Audie's, and act like you got some sense. Now, I'm not trying to eat food with crap in it. You got too many of these diseases telling you, giving you the honest to God opinion that this is truly a problem. Who wants pesticides in their food? Not I. Okay, so when you look at the brain, and you notice that I said there's lots of different things we're going to do to look at your brain. We're going to do an MRI. We're going to do a CAT scan. We're going to be doing all this stuff looking at the brain. When we look at the brain, we're focused on neurotransmitters. In particular, we're focused with Parkinson's on the neurotransmitter of dopamine. Dopamine is a great neurotransmitter. The problem is that it controls not just initiating movement, but making sure that movement is smooth. And because there's decreased dopamine in the Parkinson's patient, there tends to be an over presentation of the opposite neurotransmitter. The opposite neurotransmitter of dopamine, which is inhibitory, is acetylcholine, which is excitatory. Now, let me explain inhibitory versus excitatory. Dopamine is inhibitory, so it doesn't just help you initiate the movement, it helps you control the movement. Y'all feel me on that? That was kind of smooth how I did that. I was thinking about dancing. Okay, I'm sorry. If it's low, then its opposite neurotransmitter, which is acetylcholine, is high. Yeah, okay. So what does that mean? Excitatory means you're doing too damn much. Because a movement that was supposed to be you under the influence of dopamine, using your right hand to grab a spoon and scoop your creamed soup and take a spoonful, is now excitatory under the influence of acetylcholine and the lack of dopamine. That looks like this. You done spilled the soup all over the table. You never did get it in your mouth. It's down your shirt. Y'all feel me? Look, I'm just trying to demonstrate for you how this shit go. Okay, so that's the deal. Now, there are more signs and symptoms that they don't really fit in one of the 4 cardinal symptoms necessarily. Some of them are late signs and symptoms, and then we're gonna move on and go to another video on some more Parkinson's type shit. So here we go. Other signs and symptoms. Drooling is late. Dysphagia is late. Excessive perspiration is late. Positive orthostatic low blood pressure, usually due to the medications. So watch this patient's blood pressure. Constipation is a problem, maybe even early. Insomnia, early. Slurred, slow speech, late. So these are just some more symptoms that we know can happen, and it makes you go, well, what the heck is going on with this person? And I will tell you this. I want you to remember that this Parkinson's is so serious for the patient, even though it's a gradual process, and even though initially when they first start having symptoms, it's really subtle. 50% of these patients can go into what I would consider the worst, and that is a cognitive deterioration. Even though it happens late, I would say it was the worst thing, because now you have your dementia, forgetfulness, memory loss, depression, isolation, loss of autonomy. Ooh, you know that's bad. Psychosis, oh my God. Psychosis, hallucinations, delusions, and paranoia. And all of this is just going to make this patient need a lot of help from everyone. So, you know, if this is a family trying to manage this beautiful patient in their home, it's overwhelming. They may feel forced or even feel like it's better for the patient to put them in long-term care. You know how home care is. It's hard. It's a toss-up. We have a shortage of home care providers. And so you're dealing with a lot. And we're going to go and show you in the next video how to move from just recognizing the cues and analyzing the cues to now prioritizing your hypothesis and generating a plan of care. As I always say, deuces, but not quite, because I forgot. I told you at the end of these videos, I was supposed to be hooking you up. So let me just go ahead on and show you how much I love you. You can text me or email me if you need a complimentary copy of our study guide called the Oh My God packet. Now, don't forget to subscribe, because I'm giving you this free shit, and you could just at the very least, help a sister out. Deuces.